disease of the heart arteries people think of as being furring up of the arteries, but actually it's a really fibrotic, hard narrowing of the arteries. The arteries run over the surface of the heart and they supply the heart muscle, and if they narrow up, that's what causes problems, which is chest pain or even heart attacks. Well, I think there are several reasons. The two main ones are the disease is common and it is preventable. So in our country, in England, heart disease, cardiovascular disease is the commonest cause of death, unfortunately. So 1 in 4 people will die of heart disease. Heart attacks are the commonest cause of death. There are 175,000 heart attacks each year in this country. And we have a very good system for the treatment of heart attacks, but unfortunately the disease is common and remains a common cause of death. As a cardiologist, I find this very frustrating because the disease is preventable. And therefore we have a preventable and common condition, very important. The main methods for the prevention of heart disease are exercise and diet. So regular exercise, 30 minutes a day, aerobic exercise, that means walking, swimming, running, are shown and proven to reduce the risk of heart disease. Diet is extremely important. We think of the Mediterranean diet, so that's vegetables, fruit, fish, white meats. Unfortunately, obesity and diabetes is increasing, and we hear a lot about that in the news. And down the line from obesity and diabetes, we see heart problems. So it's really important to keep these things under control. So the mainstays are exercise and diet. Of course, smoking. Smoking remains a real problem and is one of the commonest causes of heart attacks. If we have people with known coronary disease, the other useful thing prevention is the use of statin tablets. Statin tablets are always in the newspapers. From my point of view as a cardiologist, they're extremely useful at preventing cardiac problems such as heart attacks. Angina, the key feature is that the symptoms occur with exercise. So when you're walking briskly or going up a hill, you might have some symptoms in the chest. The difficulty from that point onwards is that everybody is different. So some people have a classic tight gripping feeling, some people have a pressure or heaviness, some people have the symptoms in the middle of the chest, some people in the shoulders, the arms, or even the back, commonly the jaw. But the key feature really is that the symptom comes on with exercise. So when we have patients who give a classical history of angina, then that's relatively easy to guide investigation and management. Unfortunately, not everybody is a textbook and not everybody gives the classical history, and sometimes we have to be more suspicious about more subtle symptoms such as just breathlessness, particularly in diabetic patients. Well, in the United Kingdom, the main area of screening occurs with general practitioners. So if you have a family history or if you have problems of hypertension, you will be screened. Now, essentially that means having your cholesterol checked and to make sure that that isn't high and to see whether you are at risk for vascular disease and disease of the heart arteries. Unfortunately, that will miss a lot of people. And there is a really good method for investigation of risk of coronary disease, which is a CT scan measuring the amount of calcium in the wall of the heart arteries. It's called a calcium score. Calcium only exists if there's disease in the heart arteries, and we can assess that within 10 minutes with a CT scan. And the more calcium there is, the more you're at risk. So personally, I think that's a really useful investigation to consider if you want to know whether you're at risk for heart disease. Well, the first step in investigation is really to take the story, which we call the history, from the patient. And if the story is highly suggestive for angina, one can assume the patient does already have coronary disease. Sometimes we don't need tests to make the diagnosis. However, if we do want to investigate, there are really two groups of tests. The first group is called the non-invasive tests. In other words, we're not putting a tube into the body. And the other is called the invasive tests, where we do steer a tube up into the heart. From my point of view, the most helpful non-invasive test is a CT scan. This is a relatively new development, but we can get really good pictures of the heart arteries without putting a tube into the body. It's an X-ray test using some contrast, and that's a very useful test. The gold standard, however, and the best way of working out if somebody has got disease of the heart arteries is to take a picture of the heart arteries. That's a test called an angiogram. I do most of these via the radial artery, which is the artery at the hand. It's done under local anaesthetic, and the procedure takes 10-15 minutes to do. And it will tell us for sure if there's a narrowing, if there are problems, and what needs to be done. A coronary angiogram is the gold standard, or the best way of finding out if a patient has got furring up or narrowing of the heart arteries. It's a procedure done under local anaesthetic, not a general anaesthetic. I do most of my procedures via the radial artery, which is the artery at the wrist, although we can do it from the femoral artery, the artery at the top of the leg. Under X-ray control, we steer a little tube, it's called a catheter, right up to the heart, and then inject dye into the heart arteries and take pictures of the heart arteries. The angiogram is the best method to establish if there is disease in the arteries, to see where the disease is, and therefore to guide what the best treatment will be for that disease of the heart arteries. So an angiogram is a very useful way of making a diagnosis. It's also mandatory and an excellent step to treat people who've got problems of the heart arteries. Once we've established somebody has got disease of the heart arteries, there are really three forms of treatment. The first is medication or tablets. The second is a stent treatment where we open the narrowing with a metal tube. And the third is a bypass operation. So first line, medication is very important. There are two groups of medication. Medication to reduce the risk of a heart attack. That would include an aspirin tablet, statin tablets to reduce cholesterol, and also a beta blocker tablet. Those are very, very important to make patients safe. The other groups of medication are to control the symptoms of tightness or angina, and those would include medications such as a spray under the tongue called GTN or a nitrate tablet. Now, if the medication doesn't control the symptoms adequately, or if the patient is unfortunate and is in hospital with a heart attack, then we need to think about other forms of treatment such as stenting or bypass surgery. Well, if somebody has a narrowing of the heart artery and they have bad symptoms despite medication, or if they're in hospital with a heart attack, we can open up that narrowing. And it's done using a balloon and a metal tube, which is like a mesh called a stent. The procedure is done either from the hand or from the leg, and from there I would steer up a tube called a catheter to the heart, and through that steer a fine wire down the heart artery, and then over that the balloon, and we literally inflate the balloon in the artery to stretch open the artery to help the blood to flow back down. It's been shown over years that if you just open with a balloon, over time that narrowing is going to come back again. So afterwards we slide another balloon with the metal tube on the outside and squeeze it into the wall of the artery to create a channel, and that metal tube is called a stent. They've been a fantastic advance in the treatment of heart disease. It's something I spend a lot of time doing for people with angina or with heart attacks, and it enables us to treat people as a day case for serious narrowings of their heart arteries, when in the past they may have had to have major surgery. So a stent is a metal tube for the treatment of a narrowing in the heart artery for patients with angina or heart attacks. Well, a bypass operation is a great operation if you need it. Sometimes the disease in the heart arteries is in positions where I can't treat it with a stent, or where stenting really wouldn't do the job in the long term, in which case open heart surgery with a bypass is a better way forwards. So bypass is needed if the disease is more severe than stents can treat and will convey a better long-term outcome for many patients.